We all want our kids to be healthy, and students who don't feel well can't reach their academic potential. That is why school nurses are crucial. Their work goes far beyond just bandaging playground scrapes. However, many people have an outdated view of their specialized nursing role. School nurses are highly trained medical professionals with a unique position at the intersection of health and education. So, what exactly do they do? And how do they do it? School nurses tailor their efforts to the specific students they work with and the size of their caseload, which can include up to 1,500 students in Pennsylvania. While no 2 days are ever the same, a typical day in the life of a school nurse might look something like this. The day often begins with students visiting the school nurse before the bell rings because their parents ask them to look at a rash or sore ear. Next, the school nurse may connect with the principal about a health-related update or advisory and adjust plans for the day, such as switching to indoor recess due to heat concerns. As the day begins, a student comes to the office complaining of a stomachache. After completing an assessment, the nurse identifies the symptoms are likely anxiety-related. They walk the student through some mindfulness techniques to help deal with stressors, make a referral to the school counselor, and schedule a time to touch base with the student later in the week. The school nurse may also participate in a mid-morning school attendance meeting, and then educate a teacher about low blood sugar warning signs to watch for in a student who has been newly diagnosed with diabetes. This includes sharing an emergency action plan, created by the nurse, for the teacher to follow should an incident occur. Lunchtime may bring a playground injury with a possible dislocated joint or concussion, as well as administering routine medications and treatments. Over a quick lunch, the school nurse may make follow-up calls to local healthcare professionals, checking up on vaccination records, and processing additional state-required paperwork. The nurse may then connect with a family without insurance to help them understand their options to obtain eyeglasses for their child, and may meet with a father who arrives at the school to discuss his child's health concerns. Later, they will step away from the health office to observe a child in the classroom suspected of possibly having seizures, then head to the auditorium to speak at an assembly about vaping, helping to address the growing use in the community. The nurse might then meet with teachers and custodial staff to discuss an outbreak of strep throat and advise the cleaning and hygiene measures needed to stop the spread. The discussion with the cleaning staff raises concern that the type of cleaning supplies being used may be triggering some of the students with asthma. The school nurse schedules a future meeting with the cleaning staff to further address safer products that can be used. This school is in need of a new vision screening tool, so the nurse may reach out to a community partner to request funding and even co-write the formal grant request. As the day nears its end, they might retrieve a message from a pediatrician's office to confirm details about a student's immunization record, a follow-up on their initial lunchtime inquiry. The school day is over, but before leaving, the nurse submits an article to the Parent-Teacher Association newsletter about the strep throat concern and outlines a message for the morning announcements. And at an evening professional education session, they learn how they can help students with diabetes use a new type of insulin pump. In addition to all these activities, the school nurse has seen dozens of other students throughout the day for acute issues and thoroughly documents each encounter and activity with the required paperwork. The next day, it will start again. The needs of every student and school district are unique. However, across the board, school nurses play a crucial role in building stronger and healthier communities. To learn more about how you can support school nurses in your community, visit MosesTaylorFoundation.org.